My name is Dmitry Martinovich, and you're watching RPTV. As the COVID-19 pandemic continues to affect the global community, governments all around the world are feeling the pressure to provide some kind of basic income to millions who are out of work. Today on RPTV, I will be speaking with former Senator Hugh Segal about the notion of a basic income. Mr. Segal was the author of a 2016 discussion paper called Finding a Better Way, a Basic Income Pilot Project for Ontario. First of all, let me say what a great pleasure it is to have you here with us on RPTV today. One of the main reasons is that we're speaking with you today is that you were the author of a discussion paper that the government of Kathleen Wynn asked you to put together on what would basic income look like in Ontario. So before we begin to get into all of that, can you give us a brief description, tell us about yourself, and then go into what was your role in that paper?
I'm delighted to be here with you, Dimitri, and I'm glad to talk about how I ended up as a proponent of the basic income over a period of almost half a century. I grew up in a poor household. If one were to call it a working class, that would be an overstatement of how well we were doing financially. Two loving parents. My father was a cab driver, and my mother, when my dad was out of work, went to work as an all-night cashier at the Medical Arts Pharmacy in downtown Montreal, where I grew up. And I saw as a kid what lack of money did to a family in terms of always being behind in the rent and not necessarily have enough money for groceries or for heat or any of the other essentials. And so I was always aware of the pressures that lack of resources produced in a family circumstance, even with the most loving and caring parents, which I was very fortunate to have. And that stayed with me back in 1962, when I was all of 12 years old. Mr. Diefenbaker, who was the Prime Minister of Canada, came to our high school and made a speech about the Canadian Bill of Rights, which was the predecessor of the Charter of Rights and Freedoms, which his government had brought in 1960. And he talked about something which I'll never forget, which was the family table, the Canadian family table being broad and welcoming and generous, and we always had to make sure there was room for everybody at the family table, whether they were new refugees or whether they were farmers or whether they were pensioners or whether they were people working on the lines in the auto plants, whether they were people who were working their way up from a very low income. We had to always do that, and that made me think about, as a 12-year-old, what my obligations were, not just to myself, but more importantly to my family and also to the larger world. And that led me on a course of being involved in a series of political activities, both in high school and then at university. And when I ended up leaving university, I ended up working for an MP from Prince Edward Island, David McDonald, the United Church minister, a progressive conservative, who was a great proponent of the guaranteed annual income and who prepared a paper for a Conservative Party meeting which took place in 1969 in Niagara Falls. And that produced a great debate inside the Conservative Party. And that is a meeting which I attended and which I was exposed to. And I've been a proponent and a believer in the guaranteed income, the basic income, ever since. Yeah.
I was just going to say, what do you say to those people who don't know that you are actually a conservative, a lifelong conservative, and that the basic income, which is a very progressive kind of program, does not often square with the kind of politics of the Conservative Party today?
Well, you're right about today's Conservative Party. But the Conservative Party that I grew up in, the party of Mr. Stanfield, the former Premier of Nova Scotia, the Conservative Party of Mr. Davis, who brought in the guaranteed annual income supplement for seniors, an automatic top-up for people who turn the age of 65, and who, once they filed their taxes, if they fell beneath a certain line, would be automatically topped up by the province. A move, by the way, that reduced poverty in that segment from 35% of people over 65 who were living in poverty to under 3% in less than 3 years. So that was the kind of conservative tradition that I was brought up in. I was also aware that great conservatives like Churchill and Disraeli had been what they called in the United Kingdom one nation conservatives. And when they said one nation, they meant rich and poor. You had to govern for all and not just for one segment. And so that's the tradition that I associated myself with and believed in. And I think there's still part of that tradition in all of our political parties. If you think about something like universal health insurance, which Tommy Douglas of the NDP started out in Saskatchewan in 1963, when they did that, John Diefenbaker was prime minister, and he wasn't sure what that meant, so he retained a former justice of the Supreme Court, Mr. Justice Emmett Hall, to study what it meant for Canada. And that report was not delivered to Diefenbaker because he'd been defeated by Mr. Pearson in '63. It was delivered to Prime Minister Pearson, who then brought in universal health insurance across Canada by negotiating with the provinces and coming up with a funding formula that made it sustainable for every province in the country. So all three political parties have been involved in that thing, and that's how you build a common consensus. And I truly believe that reducing poverty and the pathologies of poverty should not be a partisan issue. There may be a debate between the political parties how best to do it, which is legitimately part of what politics should be, but the notion that we have to reduce the level of poverty so that people can live a life where they have a measure of equality of opportunity, I think is important, because we know now that poverty is a very, very accurate predictor of bad health outcomes, getting sick earlier, going to hospital sooner, bad education outcomes for the kids, difficulty with substance abuse, family problems produced by poverty, all of which end up costing society a tremendous amount of money. So we can do something about that by dealing with poverty and dealing with it directly.
So as you may or may not know, I'm speaking to you from Toronto, in the Regent Park area. And in Toronto, this has been an area of the city traditionally associated with populations who in the lower incomes. And how do you see something like the basic income playing out in a community where there are so many people on a variety of social assistance programs like Ontario Works, ODSP, seniors on benefits, students, and newcomers?
Well, let me say that when I was co-chair of the subcommittee on urban poverty in the Senate, we had hearings right across the country, and we also had hearings at Regent Park. And we met with a wonderful group of people, some of whom were involved in the redevelopment, some of whom were community organizers and volunteers, and some who were the residents of Regent Park themselves who came to tell us what their life was like. And I think one of the great things about the basic income is that unlike the deeply bureaucratic process that the Ontario Works recipients now have to go through to prove that they need the money and to prove that they're poor and to prove that they're still poor, and they're limited in terms of going out to find work because that's the terms of the Ontario Works program, limits you from working without clawing back every dollar that you're receiving. The basic income would be much simpler. You file your taxes. If you fall beneath a certain line, you get automatically topped up. We know now that CRA is much more efficient at doing that than any welfare department anywhere in Canada. By definition, welfare in the provinces is tied to a large book of rules, a large amount of administrators, and a large amount of approvals that take a lot of time. The CRA process is very distinct and very direct. If your income falls beneath a certain level, you get topped up automatically. And CRA puts money, tax refunds in people's bank accounts all the time. So the good news is it would not stigmatize the recipients because nobody would know except them and CRA, and our relationship with CRA is governed by confidentiality. if you had people in different incomes living in different parts of Regent Park, nobody would know who was a recipient because it would be a private matter. And that would not only encourage individuals to live a more active and healthier life because they'd have the money necessary to do that, but they could also go out and find work because basic income does not limit people from working. It says this is your base. If you do find work, you'll pay some tax on that. And if you earn as much as you're getting in the basic grant, you'll pay the same tax as everybody else pays on their income. So it's a much more respectful approach that says everybody is a citizen. We don't divide the community into the swells and the clients who need help and who the swells tell how to live their lives. This is about giving people the freedom to spend the money in the way they deem appropriate. And all the studies that have been done indicate that low-income people will spend the money responsibly, just like anybody else. They'll know what their own needs are. They don't need to be told by a welfare officer how to spend the money. They can do it themselves. And that's what I would think is the main positive attribute of the basic income in a place like Regent Park or any other mixed income community in the country.
In your discussion paper, Finding a Better Way, the basic income pilot for Ontario, you talk about the cost of poverty, and you bring that up a number of times. Why do you think? Why do you feel that the cost of poverty is too much for the government to bear?
Quite aside from the $11 billion a month, sorry, the $11 billion a year that Ontario spends on Ontario Works and on Ontario disability programs, so that's what the taxpayers are spending, there are other very important costs that are produced by having too many people living in poverty. When the people who are living in poverty go to the emergency wards of our hospitals because they have nowhere else to go to get help for some problem or another, that's a very expensive thing for the healthcare system. And because low-income people get sick sooner, stay in hospital longer, that's a cost to the entire system, above and beyond the $1.1 billion being spent every year on the actual programs themselves. When they have more problems with unemployment because welfare keeps them from working, that's costly. When their kids have bad education outcomes, which happens in poor families more often, that's costly. And when they get into difficulty with the law, as more poor people do than better off people do, that's costly. We had the police appear before our Senate committee from Montreal, Vancouver, and Toronto. We asked them about how poverty manifested itself in their day-to-day work. And they said, well, we don't spend a lot of time in Rosedale. We don't spend a lot of time in Westmount in Montreal or Point Grey in Vancouver. But we do end up spending more time in the low-income parts of the city because that's where the problems tend to be. And poverty produces that. And it produces, for example, more difficulties with substance abuse, which means drugs and opioids and a whole bunch of other things which are very, very deleterious for people's quality of life. So we're paying a large price for poverty, completely independent of what the programs themselves spend. There's a better way to do this that will give people stability, give them better income, give them some freedom, and produce better results for their health, for their children's education, and for their engagement in the community.
Also, in your discussion paper, you talk about how you've spoken about this a little bit more, but you really make a case for this, that all of the social assistance programs that we have now, in fact, do very little to truly lift people out of poverty. And that the systems, Ontario Works and the Ontario Disability Support Program, are mired in the process of monitoring and policing and do very little in the way of advising and helping. Why have we as a society always felt the need to associate poverty with lowered expectations, and that these can be erased through punitive measures?
I think it goes back to the 18th century, to a view that the old days of the poor houses and the poor laws, the perception that if somebody was poor, it was because of some moral failing on their part. And we know now that many people are poor because they were born into poor families and had no chance to improve their own circumstance. We know that some people may be poor because they have a physical disability, which makes it hard for them to work constructively and earn their own income. Some people may be unable to gain access to the community because they don't have the language skills. There's a whole bunch of reasons, and let's be clear, 70% of the people in this country who live beneath the poverty line have a job. Some have more than one. They're running from part-time job to part-time job to try to make enough to get by and get above the poverty line, and they don't succeed because of how poorly paid they are in those jobs. So this notion of the poor have some moral failing that has to be policed by the state before money is given out, I think it goes back to a period of time when women didn't have the right to vote, when we didn't have the Charter of Rights and Freedoms, and when we didn't really have a robust sense of citizenship and community, which I think defines the better parts of our society as we speak.
So I guess the big question for everyone is, how can we really afford the basic income? Because most people are unaware of how much it already is costing us, and even fewer people are aware of the causes of poverty, and so all they see is that a big chunk of their tax dollars is going to people who seem not to be working. How can that perception be changed?
We should look at where large chunks of their tax dollars go now. Every time a Canadian mining corporation decides to dig a hole somewhere in northern Ontario to find minerals and all that good stuff, the cost of doing that is a deductible expense, which reduces the amount of taxes they pay, which costs the taxpayer. Every time the government decides it wants to launch a major project, that of course is money that the taxpayers pay for. We subsidize things like agricultural insurance to protect the farmers. We subsidize a whole bunch of programs which are in the public interest, in the national interest, like health insurance and a whole bunch of other things. So the notion that we're only going to spend money on poor and we're not spending money on other people makes no sense at all, because we are spending a lot of taxpayers' money to sustain the basic civility and fairness of our society for a whole bunch of people who are not poor, who have no problems with poverty, number one. And number two, there's a view of for the kind of folks that you're referencing that, well, if you pay people not to work, why would they work? Well, the bottom line is the vast majority of people want to work. Studies that have been done, the basic income in places like Dauphin, Manitoba in the 1970s, show that everybody showed up to work even though they had the basic guarantee in case they didn't earn enough money. They wanted to work. Most people want to work. The amount of money that we now transfer to low-income people across Canada through the provincial welfare departments is less than 50% of the local poverty line, less than 50%. So there's nothing there that is sufficient to lift people out of poverty, but there's just enough of a spider web to keep them entangled in poverty. When you add that to the fact that if they find a job and they earn a couple of $100s a month, it gets clawed back by the welfare department dollar for dollar. So that's a massive disincentive to work. I would argue that the existing welfare programs keep people in poverty and keep them from working, where a basic income, properly structured, would give people a basic guarantee, but also encourage them to work and connect them to the workforce, and hopefully they can work themselves out of needing that support. But you want to start by giving them the support so we actually have equality of opportunity.
So you just mentioned the project in Manitoba. Of course, there have been all kinds of projects of this kind of the basic income. Can you speak to a little bit about what has happened in Canada previous to this moment in terms of the basic income?
Well, the first step that was taken was back in 1975 in Ontario. It was a minority government, and Mr. Davis was the premier, and they brought in the Guaranteed Annual Income program gains, the Guaranteed Annual Income Supplement for seniors. That spread across the country, and that was then taken up by the government, and it's GIS, Guaranteed Income Supplement, and it's automatic for everybody. So that's step number one. Step number two was the test in Dauphin that we've just been talking about, where there was a test done in 1975. Mr. Schreier was the premier of Manitoba. He was a New Democrat. Mr. Trudeau, the father of our present prime minister, was Prime Minister of Canada, and they brought that program in because they realized that the social determinants of health, low income, poverty, bad diet, bad housing, were actually increasing the cost to the healthcare system. So the purpose of the exercise was to determine if you could reduce poverty and create better quality of life for low income people, would that have a positive effect on our expenditures in other areas? And in fact, the studies that have been done by Dr. Evelyn Forget, professor of health economics at University of Manitoba, very clear. The total expenditures in those areas where the pilot project operated for Manitoba health insurance came down by 8%. Arrests came down. All the difficulties associated with poverty began to reduce as people had more security. And high school students stayed in high school to finish their program because poverty didn't force them to leave school early and go out to work to make a few dollars to help the family. Mothers who had young mothers with new infants could afford to stay home with their babies a little bit. And let's remember, this was before mat leave became a general premise across Canada. And we know now that when a mother decides she wants to stay home and if she can afford to, it's of great value to the child in its development over time. So those are the things that we've done in Canada. Just this last week, the government of Spain announced they're bringing in a basic income after the coronavirus, and they're going to bring it in for everybody because they believe it's the right way to go. The Scottish First Minister has announced that it's her intention to do the same. There are tests now going on in the Netherlands, in Glasgow and other communities across the world that indicate that there is some real momentum building around this. There's been a program in California, in one of the smaller cities of California, where families are getting $500 a month, a person, all of which is Stockton, I think it's called, Stockton, California. And so you're beginning to see a realization that not only is this a better way to provide liquidity for the individual who is now low income, but it's more efficient. Just look at what happened during the coronavirus proposition. EI, which takes time to get approval for, welfare and all the rest, the government of Canada, to its credit, announced the emergency grant, which you could apply for instantly. And I'm told that people who had applied on a Monday had money in their bank account by Wednesday. Mm-hmm. It is far more efficient than we could achieve through the old rules-based system, which requires applications and detailed circumstances. So the more automatic you make it, and look, if it's done through CRA or the provincial tax department, they'll know how much money they sent, and they'll know how much to tax you on it when the time comes to file your taxes, which we all have to do anyway. It's a much more efficient way of proceeding.
If at this moment so many countries are exploring the basic income in one way or another, the guaranteed basic income or the basic income, why do you think it's connected to COVID-19 so dramatically? Like all of a sudden, everyone, it's like a light bulb went off for everyone at this moment.
Look, when the government makes the decision, no doubt driven by the best advice of our public health officials, that aside from some essential services, everything must close. Therefore, millions of people who are hardworking employees on an hourly wage or a salary, as the case may be, find themselves without salary. and any income, the government decided they had to do something. And they realized that the automatic CRA top-up of $2,000 a month was the most efficient way to get the money quickly to people so they could begin to pay rent and buy food. So and by the way, what's interesting is the level which the government of Canada chose, which is $2,000 a month per person. Single recipient of Ontario works in the province of Ontario as we speak, it's about $700 a month.
Yeah.
I'm not criticizing the 2,000. I think that's a fair number, but it just goes to show you how probably there'll be great benefit after the coronavirus pandemic has passed, when we go through a lessons learned proposition between the federal government and the provinces. What went right? What did we do effectively during the pandemic? What can we do better in the future? I hope that income security will be right at the top of that list, so the provinces in Ottawa can work together to find a better way ahead. And I would think that a basic income structure would make a lot of sense in that discussion.
Just to get back briefly to the question of Regent Park. In Regent Park, where there's this huge revitalization going on and the neighborhood is being transformed exclusively from a low-income neighborhood to one that is a mixture of different kinds of incomes, how do you see the basic income fitting into that sort of demographic?
Let me say that one of the great ideas behind the new redevelopment of Regent Park is the notion that it's not in anybody's interest to warehouse, all the old people in this part of the city and all the refugees in that part of the city and all the low-income people in this part of the city. Creating ghettos defined by socioeconomics makes no sense at all. The best mix for everybody is to have people of different backgrounds and different income groups and different disciplines and métiers living and working together as best as possible. And the great thing about the basic income is you can have two people living less than half a block apart in Regent Park. One may be a person who has bought a unit and may be a little better off. Another person may be someone who is more working class and needs financial support. The level of support the second person gets will be as confidential as the amount of tax the wealthier person pays. It's all going to be kept separate by the law as it governs CRA and the respect for the confidentiality and privacy of the community. And that'll produce a much more well-rounded and financially secure community where people can benefit from each other's association and maintain the privacy of their own economic circumstance. And I think that's a value that would work extremely well, because you define community not by who is wealthy and who is poor, but who can be part of the community, who wants to be part of the community, what the community can do for everybody, and your private financial arrangements should be private.
Great, thank you very much. I'm just wondering, is there anything else that you feel you'd like to say as we wind down the interview?
Only that one of the great things about the Regent Park development and is the belief that individuals, families, are all part of a larger opportunity to make something greater than the individuals, a community that's greater than the sum of its parts. And that is something which I think basic income would support intensely. And it's the sort of thing we should be doing in more places across Canada. So I'm very, very enthusiastic about the kind of work you're doing and other colleagues in the community to build a better sense of awareness and understanding and appreciation for what a wonderful place it is and can become.
Thank you, Hugh Segal, for speaking to us today on RPTV. Your observations on why a basic income would make so much sense in Ontario are very compelling. My name is Dimitria Martinovic, and this is RPTV. Join us as we continue to report on stories and issues that are of critical importance to our communities.
Like, share, and subscribe to our channel. For more information, follow us on all our social media platforms. And don't forget to visit our website, as well as comment down below what you thought about this video.